How do we prepare students to work across disciplines before they ever reach the workforce? Today's guests share how interprofessional education can transform student confidence and collaboration. With a creative twist, you might adapt to your own campus. Welcome to Speaking of Higher Ed. I'm Andrew Everett. This is episode 34. In this episode, Jeff Mastromonaco is joined by Dr. Joann Denemark and Dr. Megan Mobley of Augusta University. They discuss the impact of interprofessional education on student learning and professional identity, and how one innovative activity helped bring these lessons to life. Here's their conversation.
Well, my guests today are Dr. Joann Denemark and Dr. Megan Mobley. Dr. Denemark is the program director of the newly launched Master of Health Science in Speech-Language Pathology here at Augusta University, which welcomed its inaugural class this fall 2025 semester. And she's also a member of the College of Allied Health Sciences Interprofessional Education Committee. Dr. Mobley is an assistant professor in the physical therapy department here at Augusta University and the current chair of the College of Allied Health Sciences Interprofessional Education Committee. They're both here to discuss interprofessional education and Escape the Exam Room, which is an escape room experience that the IPE committee worked with the Center of Instructional Innovation to develop. So I'd like to welcome you both to Speaking of Higher Ed.
Thank you.
Thank you.
Thanks for having us.
So we like to start by asking our guests about the professional path that led them to being here at Augusta University. So Dr. Denemark, maybe you first?
Sure. I got my bachelor's degree in teaching in special education. I did that for a few years. I really enjoyed working with kids with special needs. Then I met a speech-language pathologist while I was working, and I really liked what she was doing. So I asked her, that's what I want to do. What do I need? And she said, go back. You have to get a master's degree. So I went back and got my master's degree in communication sciences and disorders. And I worked for over 23 years in doing clinical practice, working with pediatrics to adults. And then I recently got achieved my Doctor of Education in Educational Innovation here at Augusta University. So that's my path, and I'm enjoying my time here at Augusta University in higher ed and just transforming and mentoring these new students that we have on campus.
Great, and congratulations on that doctorate.
Thank you.
Yeah.
Thank you.
Dr. Mobley?
I always wanted to be a PT since high school, so it was just a matter of getting there. And then I went to physical therapy school here at Augusta University. And when I graduated, I took a job at the Regional Burn Center here at Augusta. And working at the burn center, patients recovering after burn injuries has to be very collaborative and very interprofessional. So a lot of professions are working together to get the best outcome for these patients. And also through being a physical therapist at a pretty unique niche area afforded me a lot of some guest teaching opportunities at physical therapy schools and continuing education across the country. And so that kind of led me down a teaching path that I didn't expect. But I love to teach students about kind of these other areas of physical therapy that they may not have even realized that we could help patients in.
Okay, well, so to get to our topic of interprofessional education, I guess let's start with Dr. Denemark. What is interprofessional education?
Well, it's okay. So IPE, we all call it IPE, is where it's patient-centered care. So now in the real world, when students graduate and they go into practice, they are not just working and knowing about their own scope of practice. They have to work with others and what others do, who to refer to, if there's something else going on with the patient. So that is really what we're striving for in the real world is interprofessional practice. And that's working with others and working collaboratively, which is patient-centered, holistic care. So it reduces the amount of times that the patient has to come back for repeated visits.
Anything to add, Dr. Mobley?
I think, too, it's important because, and we may touch on this some later, but just for us to respect each other as other healthcare providers, we're all bringing different things to the table to holistically care for the patient.
Interprofessional education, it's been emphasized increasingly across health sciences in recent years. So, Dr. Denemark, from your perspective, what are the biggest drivers behind this shift, and why is it important now more than ever?
That's a great question. Well, not only does it help in the real world practice, but for me personally, being the program director and helping to develop and create this new program here at Augusta University, a Master of Health Science and Speech-Language Pathology, we have our own accrediting body. And the accreditors actually put as one of their standards, you have to expose our students to interprofessional education and collaborative practice. If you're not demonstrating that, they will, make sure that you're doing that in some way, form. But I personally, and same with Dr. Mobley, we want to be innovative. We just don't want to sit down and talk about a case study together. We want to actually do something interactive and innovative. So for me, it's really driven initially by accreditation.
Dr. Mobley?
I just enjoy it. I think it's important for practice. So that's why I value it, and I continue to create some new experiences throughout our curriculum.
So, Dr. Denemark, you've conducted research on interprofessional education. What have you learned about the impact of these types of experiences, both maybe on student learning and how they're going to function in the clinical setting later on?
Sure, yeah. I mean, I think common sense would say, of course, interprofessional is great because, students are going to learn together and it's going to help them in the real world. However, implementing IPE, having buy-in from faculty and administration. There's a lot of other factors that go into it. Organization, finding time in our very busy teaching schedules to collaborate and meet. It's come up with something very effective, and that's going to really give the students what they need in order to be to improve their professional identity. We all would think it's going to benefit. What I found in my research, though, is that students were very timid because usually they're first-year students. The ones that participated, this were all first-year students. And they're not very confident in their scope of practice, really what they're doing clinically. So they all came in, and I have proof here from some of my written reflections from my students that they were just feeling like, I'm not ready to do this. I don't know what a PT does. I'm only a speech-language pathology student, and I generally know what an OT does and sort of know what a PA does. But they learn from that. They learn so much from it. But the research shows that just giving them the transparency, that's what part of my research was based on, was the TILT Higher Ed from Dr. Winkelmess, and it's the transparency in learning and teaching, and just being transparent with the students before they actually participate in an interprofessional education activity. So before they participated in the IPE escape room, we had this open discussion as a class. Talked about questions like, what are the expectations? How are they going to be graded? Where they're supposed to go? Like just basic things. So the outcome of that was very positive. So I had 4 students that participated, and they all unanimously enjoyed the escape room. So a lot of great benefits as long as it's implemented correctly.
You mentioned it, and I did mention also at the top of the program that you worked together with the Center for Instructional Innovation to develop Escape the Exam Room, which was an escape room experience that was developed for Interprofessional Education Day. So Dr. Mobley, an escape room, it's a pretty dynamic and creative departure from a traditional lecture or even a case study like you were talking about before. What was the specific gap in the IPE curriculum that the committee maybe felt that a hands-on experience like this was uniquely suited to fit?
We thought we have some smaller experiences where we're partnered up with one other program, but really the committee wanted every program to be present, and it became it turned into a bigger experience to kick off their education and really to kick off the IPE curriculum, where they could go in and really work on communication skills and empathy towards patients. Honestly, it's the basics that we want to instill to them in this activity. And because they have just started their programs, they're not bringing a whole lot of clinical skills with them, but we felt like it would help them start to learn more about each other's professions and how to communicate with each other.
Mm-hmm. So to put this in a little context for our listeners, this experience, the students were tasked they were tasked with assisting a doctor in developing a care plan for a non-compliant patient. The doctor has hidden patient information in different locations in a patient exam room, and students from different disciplines must work together to solve riddles left by the doctor and ultimately to escape the exam room and then provide a recommended care plan. So Dr. Mobley, can you maybe paint a picture of this experience? What does a student, maybe from physical therapy or nutrition actually experience when they walk through the door? And suddenly they're teamed up with students that they've likely probably never met before.
Mm-hmm. Well, we do start with the experience starts with a pre-brief. So they discuss an article that we provided with them ahead of time, and that gets the conversation rolling. They get to know each other prior to actually stepping into that exam room, which is an escape room. But they do have to learn how to work together and listen. Listening is important too with this experience to everyone's ideas on where these clues may be and where the next steps are hidden.
Anything to add, Dr. Denemark?
Yeah, I mean, I think PT starts in the fall as well, right? Mm-hmm. So these are students, first-year students. This is their third week as a graduate student. SLP, PT, I think OT starts, this is their second semester, but still they're all first-year students. So they are really deer in headlights. They may not say it, but I know that they're all like, I don't know what I'm supposed to do. I don't know everything. Because that's why it's important to do the transparency. But just to see that from the pre-brief and then actually doing the exam room and then the debrief and seeing, especially reading some of my written reflections, how they grew and understood. And initially they were timid, maybe even scared, or didn't really think they're not going to get anything out of this, to, wow, this is what I'm going to take away when I'm actually practicing, and how it transformed their whole professional identity, really.
Okay. So this, I think, is the fourth time that we've hosted this event, and on a pretty big scale. So I think this year over 160 students from 5 graduate disciplines participated. It's a pretty massive undertaking. So could you talk, Dr. Denemark, a little bit about the collaborative process of designing this event, and particularly maybe how you worked with the Center for Instructional Innovation to bring all this to life?
Sure. Well, I love the Center for Instructional Innovation. You guys are like geniuses. I feel like, not like, you are geniuses, very creative, innovative. I mean, this, I can't say thank you enough. And same with Dr. Mobley. I'm sure she feels the same. But we initially came together, and I hate to say it, it was almost going to be canceled because there was just a lack of, because we're all so busy, and it was coming, the date was coming, and we were like, well, maybe we should cancel. And that's when I reached out to your office and I said, please, we don't need to cancel. This is one of the most talked about activities from the past 4 years. Even though this is my first cohort, every single student that I've ever come in contact with from my volunteer during the IPE day is all positive. So we just came together. We all are IPE champions. And we just, I reached out to you. Then I reached out and said, Megan, let's do this. And there was a core group of us, and we made it happen. We're so excited. So thank you. Really, it's to you. All credit comes to you.
I think, and I can probably speak for the rest of the staff too, that I think more than any other project that we've been able to work on, to see the effect on students, and initially when we started working with you and establishing those learning objectives, and to see how they were fulfilled, and that we actually, a gamified experience like this was making an impact on the students. So you mentioned it a little bit before that when we structured all this and you created the experience, you have a dedicated icebreaker at the start and then a reflection at the end. So how critical do you think that those bookends to the learning process, and maybe talk a little bit about some specific aha moments that you observed with the students during that final debrief? I guess we can start with you, Dr. Denemark.
Oh, sure. Well, may I read from some of this? So here is one student. So at the end, we finished by 5 o'clock that evening. And for my students, I gave them written prompts, and they had to have a written reflection, try to get that metacognitive, and I gave them some prompts, and it was due by 11:59. I made the mistake of at 11:59 reading them, and I was up till like 3 in the morning because it was so exciting to read what the students, like what they learned. So one of them, she said, before this IP activity, I truthfully went in with a fairly low expectation. I assumed it would just be another exercise where we talked about our professions and who we were at the surface level. On top of that, just for overviewing the case study, it didn't have a lot of direct focus on speech-language pathology, so I wasn't sure how much contribution I would be. However, when I started talking to my group, I knew we were going to work extremely well together. Everyone was engaging, respectful, open to hearing everyone's stories. Moreover, my group made a space for me and wanted to learn more about my journey to SLP and how it fits into a bigger picture of patient care. And the continued written reflections talk about that. They were so appreciative to know why the PT students chose PT field, OT, PA, nutrition, and their scope of practice. I have another one in here. They talked about, I don't want to take up too much time, but like PAs there are some of their misconceptions. PAs thought that they were like nurse practitioners. OTs thought they only work on handwriting. PTs only work on exercise. But there's so much more that they learned about each other's scopes of practice, their responsibilities and roles in healthcare.
I think the icebreaker helped them like get to know each other better before they're about to work as a team to try to escape the escape room. And I've learned over the years of being in higher ed that the debrief is critical too. So you create these experiences, but you want to make sure you're driving home what do you want the students to get out of the overall experience. So having that debrief time at the end to come back together after each, we had a lot of waves of students coming through, but I think 6 teams at a time would debrief together at the end, and they could kind of share their experiences, the different experiences that were happening in each room simultaneously.
And may I include, a reflection about the debrief. So this is just one student. Even though my group did not escape the room, our collaborative approach ultimately made our decision-making process stronger and more comprehensive. One teammate pointed out that our hesitation to use hints in the escape room mirrored real-life situations in healthcare. Professionals sometimes avoid asking for help. And this reminded me that collaboration and seeking support elsewhere are not weaknesses. I think that's huge because we're supposed to know everything about our profession, right? We're supposed to know everything about your profession, but we don't. And actually, they are good strategies that will provide the best plan of care for patients. And it's so insightful. I just love that.
That's true. They would lose a minute if they asked for a hint.
Yes.
But sometimes they would spend 10 minutes trying to figure it out. So in hindsight, they could have asked for a hint and just lost 1 minute. So it is true. Yeah, that's a great perspective from that student.
Yeah, I think especially when you are talking about gamifying education or gamifying experience, it's great to design these things where they are engaging and fun and all the things, but you probably arguably could gamify anything as long as you had that reflection at the end. And the other thing that, especially with this project more than any, it occurred to me is that this was a really good example of the value of failure. And so, through failure, the students were able to fail and try other things, and they had options and they had different ideas that actually forced them to listen to each other to solve these puzzles. But a lot of them actually failed to actually escape in time. I think this year, less than half got out, and there have been years similar that's happened. And then during that reflection, they have the opportunity to, talk about why possibly that they didn't. Did they not listen? Or, did they not understand? Or, what were some reasons why maybe that they didn't fail? But they're able to do it in kind of a safe, low-stakes environment. Exactly. This is an experience that they weren't getting for a grade. But, so they were able to kind of, I guess, take chances and things like that and come away learning more without the worry of a grade or anything. So. Okay, so zooming out a bit, some educators, they still might see interprofessional education as a supplemental activity. So based on your experience with events like this, why would you argue that IPE is essential and maybe even a non-negotiable component of allied health education?
You want me to go first?
Sure.
Well, in in my graduate education, which was over 20 years ago, I did not get any kind of interprofessional education practice. We didn't even talk about that. We briefly talked about what maybe a PT and an OT does. It wasn't until I was actually in my internships and then practicing that I realized, wow, we really work so closely together with a lot of professionals, healthcare professionals, physicians, different specialties, parents, families, you name it. So it is so important to know and to be comfortable talking. It's not just, not knowing everything about your profession or your role, your scope of practice, or knowing what PT does, but just being able to collaborate, respectfully communicate and listen, and to be vulnerable and say, I don't have the answer, but I'm going to collaborate with you. I'm going to ask for your opinion. So I think that's so important. Why we should include, not just because accreditors want it, but because it's so valuable in our healthcare profession and patient-centered holistic care.
Just last week in my wound management course, I had an IPE experience with the Department of Nutrition. And so the dietetics students came down to the physical therapy department, and we had a patient case on a patient that had diabetes that also had a wound. So there's a lot of nutritional specifics and needs for that patient, both for wound healing and their diabetes management. And so the students were able to work together. And I felt like I could sit here and lecture on the nutritional needs of somebody with diabetes or somebody with a wound, but it'll be so much more impactful if they hear it from a dietetics student, from their perspective. I think that also is going to help them respect that profession in the field later on too. So it just, I think, has a bigger impact when we try to set up these IP experiences.
And just knowing what other professions do, knowing who to refer to is huge. So just having some knowledge of what a PT does, and okay, I need to refer for exercises to the PT. Or if there's a diet issue, I need to go to the nutritionist and ask. So that's so important, just to know who to refer to.
Mm-hmm. Well, so Dr. Mobley, while in Escape Room, this particular experience, it focused on healthcare disciplines. Those IPE principles, I think, can apply much more broadly. So how might faculty in non-healthcare fields maybe think more about adapting this kind of collaboration with their students?
I think that's kind of hard for me to I guess, try to figure out, just more coming from my healthcare perspective. If there are other fields where everyone has different roles and different perspectives and they come with different knowledge, how can you support one another through a common interaction?
Dr. Denemark, anything to add?
Yeah, I think it's a universal. I'm not familiar with business, the program or what they do, but I know for education, definitely. We have educators, special educators, visual impaired educator. We all work together in the school-based system with speech pathologists and PTs that work in schools, OTs, principals, counselors, so it's definitely doable in the education field. I think really anywhere. It's just being creative and having the help of CII.
Yeah, right. Well, and I think, just like you guys were saying, having an understanding of what other roles may be, and I think education is a good example, but then also communication. I think as far as this experience is concerned, was definitely something that you saw, that the groups that listened to everybody in the group, they're the ones that either got out or got a lot further, I think a lot quicker, where there were some that maybe just didn't speak up at all, and some that maybe just dominated the conversation. You could tell that they weren't going to do as well. So I think communication overall is definitely a good lesson. So Dr. Denemark, you are the program director for speech pathology. And how does this work in IPE? How does it specifically maybe inform your program's curriculum? And then how would it better prepare your students maybe for the realities of being on a clinical team after graduation?
Oh, yeah. It's so important. we actually, when I was developing the program and the curriculum, there's actually a course called Clinical Processes and Interprofessional Education. It's actually happening this fall. And because I knew, not just from the accreditor standpoint, but it's so important. And that I was lucky to be able to be part of the IPE team, even before speech pathology students were here on campus. So I really, as I was getting involved with the collaboration and planning, I really thought, this is wonderful, because it's something I never had. I know it's so impactful, and how can we improve it every year? I think we're just getting better and better every year. So from my perspective, it is definitely interwoven in every course, but we do have a specific course that we developed. And it just makes me think all the time when I'm teaching, like, how can we make this even more better? Because we're always collaborating with other programs, other healthcare professionals in the real world. So let's collaborate with our other sister programs. It just makes sense.
So Dr. Mobley, ultimately, when a student finishes this experience and walks out the door, what's the one core mindset or skill that you hope that they carry with them? So not just through their, to their next exam or in their other coursework, but I guess entirely throughout their professional career.
It probably would be respect for other professions. So again, we bring different knowledge, different experiences to the table, and the patient's going to benefit from each one of us being involved in their care. And so listening to each other, making sure that it's a team approach as far as holistically taking care of that patient. And I was a student here at Augusta University. It was Medical College of Georgia at the time, but we've always been a health sciences campus with a lot of different professions. And I'm so glad that we have a speech program now, because even as a student, I was like, we're missing a speech program. Because ultimately, when we graduate to become healthcare professionals, we're going to be collaboratively working together. But as a student, I even felt like all these programs are siloed and we're not interacting. We have anatomy together with a couple departments, but we're not interacting with every department. And then when we graduate, we're going to be expected to know what these other professions are and what they do, and work with them together. So I, even as a student, felt like that was something that was missing. And so I continue to try to keep adding it to the courses that I'm in.
Maybe Dr. Mobley, we'll start with you. Can you talk about, our listeners, I think, would be interested, especially from other institutions. This was a monumental task to organize and to get together. So maybe talk a little bit about how this IPE committee, maybe how it came about, and some of the maybe the pitfalls of trying to work collaboratively across a campus like this?
So it became as an idea that we brought to our dean of the College of Allied Health Sciences to start up an interprofessional education committee. And from there, we had to try to find champions from every department in our college that was interested in being a part of it, that would be able to come together, sit at the same table, and discuss what we wanted to do as far as creating interprofessional experiences. Some of the challenges is that we're all in different programs, different schedules. What we teach each semester might not line up with where speech or occupational therapy is teaching different content. And so what our committee has become is having 2 faculty that are champions for interprofessional education on our committee, so that hopefully we can get at least one person from every department around a table as far as planning and communicating where our next steps are. And then they can go back to their colleague that may not have been able to be present at that meeting, as far as keeping them up to speed with what's going on.
Anything to add, Dr. Denemark?
Yeah, I mean, it's just, like she said, the IPE champions. I mean, it's very difficult with our teaching schedules. I knew the value of this escape room. So I actually teach all day on Tuesdays, and it happened on a Tuesday. So I canceled class so the students could participate. And then we just rescheduled class on Friday, the following Friday, because of the value that really it just brings to, and I could see it in the written reflections. So it was worth it. It's extra work on my part, on her part. We don't get paid extra to do this, but we see the value, how it's going to help the students in their professional care whenever they go into practice, and also overall it's going to help healthcare in general with patient care. So
it requires some flexibility with the students too, because my activity last week was outside of their normal class hours, but they value it. They see where there is value in these activities, and so they were open to participating and seeing the value in it. But it had to do with when does the dietetic students, when are they available versus when my class was available to meet together.
And to your point about scheduling, this event, each iteration basically kind of occurred for most of the day, if not all day. Mm-hmm. And we would move teams of 5. I think we would run like 6 of these rooms. And so try to move as many students as we could through there. But, being able to coordinate all those different disciplines, because if you didn't have that mix of students, you really kind of, the purpose of it kind of fell apart. So I can remember that on its own being a bit of an issue. And this project itself was kind of unique in that it had to occur on a specific day. So, we had that deadline. Mm-hmm. And so I can imagine for you in this committee coordinating all those things and being able to get back to, to us and being able to, I guess, come to a consensus by committee of, is this okay? Is this not okay? I, imagine could really be a challenge. We're going to take a quick break. And when we come back, we will ask our continuing the conversation question.
Got a teaching idea worth sharing? Share it on AU Teaching Commons. We are Augusta University's first peer-reviewed hub of open teaching resources by faculty for faculty. Share your knowledge, help your peers, impact students. Visit us at guides.augusta.edu/AU Teaching Commons.
We are back. And before we get to our continuing the conversation question, is there anything that either of you would like to add or touch on?
Yeah, may I read some of the written reflections for my students?
Oh, sure, of course.
So one of the prompts was about looking towards the future. How did this escape room experience, IPE escape room experience, how is it going to help them in the future? Or what is their main takeaway as well? And so one of them said, my main takeaway message from this IP experience would be the importance of a holistic, patient-centered care approach. This hands-on event is beneficial because instead of just talking about the importance of its separately in our own classes, we get to try it firsthand together during our studies in a fun setting, and not only once we are out in the real world with our own patients. And another takeaway, which I mentioned earlier, is the student said the importance of not hesitating to speak up. So I think that's a great reflection. Another one, I believe the IP experience will most definitely influence my future practice. Today's activity enforced the knowledge that working collaboratively across disciplines is the best way to achieve patient-centered services that look at the patient as a whole and not merely a collection of separate, unrelated diagnoses. Mm-hmm. That's just profound. I just love that. And I'll just do the last one. I really enjoyed the escape room. It was amazing to meet people from the other programs and work with them in a fun way instead of sitting down and working on a case study or other classroom assignment. So thank you, CII.
Anything to add, Dr. Mobley?
And so they built relationships that day too. And we all have classes in the same building. So they're running into each other in the halls. They're eating lunch in the same spaces. So it's neat to watch them create these professional relationships, even as students, that they may, keep in touch with each other when they're out working professionally.
For faculty or department heads at other universities who are inspired by this idea, what's the single biggest piece of advice that you would give them before they attempt to launch a large-scale interprofessional simulation of their own? We can start with you, Dr. Denemark.
Sure. I think it's to find your IPE champions, definitely. I mean, you need faculty that understands the importance of IPE, not just an escape room, but just IPE in general. And they have buy-in. Also, resources. We need, it does cost money and to put on a really good, effective IP event. But part of my research study that I did was, even though IPE is great and it's recommended by our accreditors to include in part of the curriculum, it is very difficult to initiate. It's very difficult to plan. Some of my empirical research said that a lot of the IPs fall apart because just the initial planning part, like there's just not enough time in our teaching day, like to give to the planning that it really needs in order to pull off a really effective and beneficial activity. So I think that's huge, is just being realistic and knowing you just can't say, oh, we're just going to do IP activity and we're just do it next week. Like there is a lot of planning involved. So, but the main thing is just having IPE champions on board that understand the importance.
Mm-hmm. Dr. Mobley?
I would say it took a lot of communication and organization. So we were probably starting this process a year before we did the escape room, reaching out to your department, the CII, and trying to get some funding as far as to buy the supplies that we needed for the escape room, as well as reserving the simulation center that we used. We have a simulation center on campus with several looks like doctors' exam rooms. And so in order to reserve that space, you have to do that over 6 months in advance. It took a lot of communication with all the champions from the various departments on what day we would land on to schedule this, because this event was going to take all day to get all these students through. And so we had to communicate, we had to be flexible on what day we could all get together to make this happen.
Well, I know if anyone out there, our listeners or viewers, would like to learn more about interprofessional education or about our two guests, there will be information on our show page, which can be found at augusta.edu/innovation. I'd like to thank you both for being on Speaking of Higher Ed.
Thanks for having us.
Thank you. Yeah, I enjoyed it.
Thanks for listening to Speaking of Higher Ed. You can find all episodes and more on our show page at augusta.edu/innovation, and continue the conversation with us at facebook.com/AUGCII. Speaking of Higher Ed is produced by the Center for Instructional Innovation at Augusta University.